It says setting up your meeting for Facebook Live. So I wait for that to happen.
You're on now.
Okay. Hi, everybody. Can you see me, Emily? Great. Welcome to the VBF December 2021 Facebook Live, our final one for the year. And by the way, since we started these in 2017, we've actually done over 50 Facebook Lives with total 1 hour views exceeding 150,000 hours. So that's pretty impressive. And just so you all know, Dr. Waner, who you can see on the split screen next to me with the light flickering on and off behind him, he is actually coming live from Berlin. And let me just pull it up. I'm getting it on my screen so I can see the questions coming in and the people that are on. So Dr. Waner is in a restaurant in Berlin, but he's here. So that's all that matters. I'm not seeing it live on here.
It is.
Okay, Emily says it is. So I'm gonna. Oh, there we go. There we go. Let me just put the volume down. All right. Ava Pyle says hi, Dr. Waner. Carol
Hi,
Taylor.
Yes.
Carol Taylor Franks says Gemma McEwen and 6 other people are watching. All right, so we already have 12 people on. Welcome everybody to the December 2021. Thank you, Dr. Waner, for agreeing to be with us. And now you're in Berlin, which means travel is open again, and all your European patients can now see you either in Berlin or Greece, correct?
That's correct. Yeah. So I'm in Berlin actually doing surgery, seeing patients. I'm at a restaurant right now, and believe it or not, I'm the host of the dinner, but I think VBF Facebook Live is more important. So they'll just have to get by without me for a while.
Yeah, they're just gonna have to
and
get
besides, by. Linda would keep my head off if I so
like
here
that.
we are. So the reason it's flashing is that I'm on a balcony outside the restaurant in Berlin, and it's nighttime here. It's about 9 o'clock, and that's pretty much it.
So
I'm ready to go.
We're ready, and Katie is on from Ireland. Hi, Katie from Ireland. Hi, Jeremy. We are ready to take any question regarding diagnosis or treatment of vascular anomalies. Where you can see we have Olivia from Chicago's on, Cheryl's on from England. Stay tuned, Cheryl, for an announcement that will be coming out soon about more access in Europe with Dr. Waner for our UK area people. So we've got something in the works that when he's ready, we'll be making an announcement. Everybody will be very excited to know about that. It's just a little teaser, Dr. Waner, just a little teaser.
No, it's fine. You can talk about it. It's okay.
So Christy is on from Idaho. So we are ready to take your questions. Lisa's on from Saskatchewan. Again, diagnosis, classification, treatment of all vascular anomalies, any hemangioma questions, port wine, venous, lymphatic, arterial venous, CMTC, KTS, Facey syndrome. Dr. Waner is working on a number of research projects. He's got his primary practice in New York City with his partner, Dr. O. And also, we have our first question. And also he's now doing cases in Greece, in addition to being in Berlin for what, 15, 20 years. So our first question comes from Tara. She says, I'm going to have jaw surgery for weak chin due to underdevelopment. I'm not sure. I remember her being in our group, so I think she has an ABM. Do I need to worry about going back? Oh, she has the bone overgrowth port wine stain. So she wants to know if it's going to be going backwards on her laser treatments. Will it come back and darken after she has the jaw surgery? Like, will that make it
Yeah.
get worse?
Yeah, absolutely not. There's no connection whatsoever in terms of that. The jaw surgery is very important, and it will not affect your port wine stain, and it'll not have you take a few steps backward. So don't worry. And you know, you'll just carry straight on after your jaw surgery. So there's nothing to worry about.
Jesse's on saying hi to you from Australia. And
Hi.
we have a couple on from Croatia and the Ukraine, and they're all chiming in. So Dr. Waner, regarding that bone overgrowth with a port wine stain, is there any, oh, there's somebody on from Italy. Lorenzo is on saying hi. Is there a way
Hi.
to predict when a port wine stain will have bone overgrowth? Like, can we predict that?
Okay, so this is something that I've actually been studying right now, or I am studying right now. We know that overgrowth of all the tissues takes place, not in all port wine stains, but in some. And we haven't figured out a way to tell which ones will have overgrowth and which ones will not. However, we are doing some gene analysis, and I'm pretty sure we'll come up with some genes which tell us which will and which will not. But, you know, bony overgrowth is something that happens. It happens predominantly in a growing skeleton. By the time the skeleton stops growing, it seems that the bony overgrowth slows down. It doesn't stop altogether, but it becomes fairly negligible. So the growing years are really pretty much in the early and mid-teens, and that's when we see a lot of bony overgrowth taking place. We see the same thing with tissue overgrowth. It seems to correspond with certain times, and certainly the teens are a time that's very common.
So we've always known that they're very hormone sensitive. So
that's correct. That's correct. Yeah.
Olivia has a question for you. She says, we suspect my son inherited CM AVM from my husband. We're currently doing blood work to confirm. Our son has vascular stains on his face and body. We'll monitor periodically with imaging to detect AVMs in his body. How do we think about the risks in deciding to have another child if this is inherited?
It is inherited. I think it's an autosomal. Is it an autosomal dominant, Linda? I believe it is.
Yes.
So, yeah. So that means that 50% of children will have it. I need to look up the percentage, but I believe it's 50%. So, you know, that's your statistic right there. Has the child been tested for a certain antibody, RASA1? That's something that you need to look into, because I think that that's something that you can test for and see what's going on. But in terms of the statistics, I believe it's about a 50% risk. So you can test in utero. I don't think the test is commercially available, but I know that some labs will test. So during the pregnancy, early on, you can have an amniocentesis. Some of the cells can be sent specifically and prearranged to a laboratory for testing. And if the fetus is positive, then you can make a decision depending on your beliefs and your and what you want to do. So A, it is about a 50%, and B, it should be possible to test for with amniocentesis. And you can do this quite early in pregnancy.
Thank you for that. Jeremy wants to know, he said, you met my son Cohen a few months ago. It may have been our super clinic in New York to look at his lymphatic malformation. It is now significantly smaller. Do we still need to treat? think you might have
Yeah.
to look at pictures, right?
Yeah, yes, you do need to treat because lymphatic malformations get bigger and smaller. And this is they have a natural tendency. Now, is it smaller because it was treated, or is it smaller because of the natural fluctuation of the lymphatic malformation? If it's
Yeah.
smaller, yeah. If it's smaller because of the natural fluctuation, we know that lymphatic malformations get bigger and smaller and bigger and smaller. And as a consequence, ultimately, I mean, it may be in the shrinking cycle, but it'll eventually go back into a growth phase and will enlarge again. So you should have it treated. There's no doubt.
And we tell parents all the time that swelling and shrinking usually is associated with them being sick or having some kind of virus circulating in their body, or a cold, or their teeth are coming in and stuff like that. So
that's correct. So there's three things that cause the lymphatic malformation to activate. And as Linda mentioned, it's hormones, and so puberty, etc., infection, and trauma. And it's not every infection. It's infections like certain viral infections can do it. So, you know, that's kind of what we're talking about.
Okay, thank you. So Esther is writing from Canada. She wants to know if there are any benefits to treat an intramuscular venous malformation of the masseter, even if my son is only 4 months old and doesn't show one cheek bigger over the other. I'm afraid that it will impact the growth of the muscle or create a malformation in the long run.
Okay, so this is an important question. If your child has a vascular malformation of the masseter muscle, eventually it will become visible. Now, that may happen at any stage, depending on how aggressive and how extensive the malformation is. In some instances, it doesn't become visible until the 20s. In other instances, it becomes visible at 3, 4, 5, or 6. So there's a great variation, and it depends on how active the vascular malformation is. Now, it should be treated. And there are different ways to treat it. Early on, if it's not visible, it probably is possible to treat it with sclerotherapy, and it should be done by an interventional radiologist. And they may be able to stop the malformation from enlarging. They can't cure it completely, but they can certainly stop it from enlarging. And then, of course, there's surgery. Now, that's this type of operation, or this particular operation, is an operation that I developed, and I have probably done more than anyone else in the world on this. The facial nerve sits directly on the masseter, and so you have to find all the branches of the facial nerve. Facial nerve is the nerve that innervates the face, makes the face move. And so you have to find all the branches, move them away, remove the masseter, and then replace what was there with some abdominal fat, so some fat from the belly. This is an operation that I do probably once a week. And this is it. Now, it's best to avoid surgery, and it's best to prevent surgery from becoming necessary. So I would follow up very carefully with somebody who knows what he or she is talking about, and prevent the malformation from ever enlarging to where it's clearly visible. And so what I would say is at some stage, your child will need sclerotherapy. You know, exactly at what age, I can't tell. Depends on what we find. If you want to send me an MRI and a photograph, I'll be happy to take a look at it for you.
And I think that's an important, you said it was important, but I think what's so important is you have to look at it in a complete way. And if it's not visible or not causing a problem, you know, it's there, they know it's there, but he looks symmetrical and it's not a problem. It's that decision. Do you treat before it becomes a problem, or do you wait until it becomes a problem and treat?
Yeah, you know, that's very, very important. And there are many, many considerations with that. But, you know, if the malformation is not visible, and it's not going to be visible in a young child, at some point it will. And if you're aggressive, you can prevent it from becoming visible. And that's what we should aim to do.
I agree. So great question from Christy Bass. She's 43, and when she was young and she had laser treatment, she received very poor clearance, but she just started 2 years ago, and now she said it's like 70% lighter. And so she wants to know if you've had adult patients that, you know, started getting laser later in life and had very good or complete clearance when, you know, in their 40s, and now with better technology. So is this
Yes.
something adults with port wines should be excited about?
Yeah, absolutely. In fact, the technology is excellent. But one of the things that we see is that, you know, I'm beyond the 40s. I won't tell you exactly where I am, but as we get older, the collagen stretches out, your skin becomes sagging a little bit, and the skin thins. And when the skin thins, port wine stain vessels will enlarge and darken. But at that stage, the port wine stain is more amenable to treatment. And in fact, we very often find those darker port wine stains in 40, 50-year-olds who've never had treatment before respond dramatically to treatment. And so this is something that we see, and we see it quite often. So there is hope. If you haven't had any treatment, go ahead and do it. And it's never too late. And you can get an exceptional result in the 40s and 50s.
Thank you for that. Katie Nolan has a 3-year-old child with a mostly microcystic lymphatic malformation in the apple of the cheek, the jaw, the floor of mouth, tongue, epiglottis, and wants to know if debulking would be effective with the area in the cheek. She's been on sirolimus for a year with little effect. PIK3CA confirmed. Would sclero or bleo be effective for the tongue, the face? How would you approach this?
Okay, so if it's visible, then sclero is not going to shrink it. Sclero can stop it from expanding, but in my experience, sclero doesn't really shrink it. So if it's visible, the best way to deal with it is surgically, and that's my recommendation. Obviously, I'd have to see the MRI and I'd have to see photos of the child, but my recommendation is to go ahead with surgery. Now, remember, if it's in the apple of the cheek, that's exactly where the facial nerve is. And so whoever does the surgery must have a lot of experience in operating in this place, because I'm operated, in fact, I operated today on a child who had come from somewhere else and had had previous surgery, and the previous surgery was unsuccessful in removing the vascular lesion, but successful in destroying the facial nerve. So right now the child's, or not right now, I've just operated on the child, but the child had a very large vascular malformation, and unfortunately the facial nerve was not functioning. So, you know, it's very important to go to the right person and to make sure that they have experience with that. So just to, in order to not get complicated, yes, you should seek out treatment. Surgery is the best treatment. Just go to somebody who has had experience. That's the most important thing.
I agree. Kylie says, we are in the middle of diagnosing my 6-month-old son with a possible vascular malformation on his left shin, just under his knee. Ultrasound and x-ray were clear, So we are doing an MRI. Can I assume the malformation is small if nothing came up on ultrasound? And would the surgery be the best solution? And what would, recovery look like for an infant? The VM leg already has significantly less muscle compared to his normal leg. I'm worried about his growth and mobility at such a young age. So he's only 6 months old.
Yeah, it's 6 months old. I mean, you can't assume anything. You've got to look at the MRI. Ultrasound is a good investigation, but ultrasound doesn't. The standard investigation is an MRI. It depends on who does the ultrasound. There are some people who are exceptionally good and will pick up everything, but by and large, I would not go with what ultrasound shows. I would go ahead and get an MRI. I mean, there are a lot of questions that you've asked about your child, and there are a lot of things that we can't predict. The only way I can give you an adequate answer is to see photos of your child and to actually get a copy of the MRI, and that will tell me exactly what's going on.
We've been posting Dr. Waner's contact information throughout the thread here, so you can always just scroll ahead and you'll get his contact info.
Yeah, but I have to say that if there is significantly less muscle, that means the leg is somewhat atrophic. I mean, we're dealing with, I believe, a significant vascular malformation. And so I would go ahead and get an MRI.
Okay, thank you. Tabitha said her daughter is Solana Edmonds, and she has a venous malformation in the center of her upper lip. And she said Dr. Waner did surgery on it in 2005 when her daughter was 3 years old, and 2011 at 10 years old. Both times it looked great, but it regained some of the mass and still has discoloration. She's now 19 and conscious, particularly when it's cold. Her question is, would it be safe to get permanent tattooed lip color? This would tattoo directly to the affected lip area atop the venous malformation.
Yeah, that's a question we face very often. I don't like tattoo because it's permanent. And if the malformation expands and becomes darker, the tattoo, which initially looked okay, is going to look much worse. And the tattoo ink will interfere with our ability to laser or treat in other ways the lip. So I would never advise somebody to get tattooed. That's something I would avoid because of the problems that develop later on.
And I've been hearing you say that for 25 years. And so we repeatedly tell patients who contact us and say, I want to tattoo it. We explain just like you did. So thank you for reinforcing that. Ellen is a 63-year-old female with left side facial port wine. She's had lots of lasers for over the last 30 years with no improvement, mostly pulse dye in England. Do I have any options left?
Well, a percentage of port wine stains don't respond to laser treatment. And provided the people treating have been experienced and know what they're doing, in other words, provided that the treatments are good, you probably fall into the category of those that don't respond to laser treatment. Now, at this stage, there is not a hell of a lot we can do. There is a lot of research going on. I know Stuart down in California is doing a lot of research, and various people are looking at ways around this. But at this stage, there isn't much we can do. So I have to say that, unfortunately, if it's not responded to adequate laser treatment, then it's not likely to respond to anything else that we have at the moment.
Well, one thing I'd like to say, though, maybe this might change you a little. We don't really know what laser or the settings or how aggressive or passive that person is. She is in Europe. Would it be beneficial for her to try a different place in Europe and try even a test spot, like maybe when you're in Athens, you could try it
Well,
and see?
sure. Well, that's valid. So what I said was adequate treatment by somebody who knows what they're doing. And you're 100% right, Linda. We don't know who did the treatment or who's done the treatments. And it's not a bad idea to get a test spot. So I think the patient comes from the UK, if
Right.
I heard this correctly.
Yes.
So, yeah. And, you know, I'll be going to the UK at some stage, and I'm pretty sure we can set something up.
Okay, great. So stay in touch with me. I can also put you in direct touch with Dr. Waner to let you know his schedule in Europe between Berlin, Greece, and UK. And also we have some free laser clinics in the US. 6 of them will be going on next year. We have one coming up in Italy in March. Okay, so HS Beacon says, my son has a VM just next to the nasolacrimal duct above eye and near sinus. It suddenly turned dark blue this week. Should we be worried? We are not aware of an injury, but the color changed suddenly and it looks almost bruised. So this is probably maybe a little venous malformation near the little what did he call it?
Yeah.
Nasolacrimal duct.
Yeah, so it's probably it sounds like an upper eyelid malformation. Should they be worried? It suddenly changed color. Yeah, no, there's nothing to worry about. This is part of the natural behavior of vascular lesions. It might have formed a thrombus or a blood clot. Now, blood clots don't travel, and it's not going to travel to the brain or anything, so don't worry about that. It may be a lymphatic malformation, and there may have been, or a mixed venous lymphatic malformation, and there may have been some bleeding into the malformation, which caused it to turn blue. So there are many reasons that something could change color and that the color intensity could darken, either a small amount of bleeding, or alternatively, it could be a blood clot that's formed. I would see somebody and make sure that they agree that everything's okay, and then just watch it. Okay, so provided, and this is a child, I take it, so provided the child is seen by somebody, then it's okay. There's several reasons for this.
Okay, thank you. Magda, I'm not quite sure of your question. You said, can we ask Dr. Waner if for ML in the skin, I don't know if you mean a microcystic lymphatic malformation, but you're saying if for a ML in the skin to have laser, I speak of Lorenzo. I don't know if that's one of your patients, Lorenzo.
Oh, yeah. I know who you're talking about. Yeah. So what is the question?
Can he get, is laser the only option?
Yeah. At this point, yes. Laser is the only option. This is a specific patient. So, so the patient has skin involvement with venous malformation. And I don't know if there's anything else that we can do. So the answer is yes. At this stage, that's what we've got to do.
Okay, thank you. So
Okay.
Eva Gelia is from Greece, and she has a question related to her 17-year-old brother that has a birthmark that looks like a wine stain on his leg. He also has muscular dystrophy Becker, imbalance, and lymphedema. The doctors speculate it's Klippel-Trenaunay syndrome along with FAVA. Have you seen something similar? Do you know what syndrome causes this? That they don't have the DNA back, but they were wanted to use beta blockers and sirolimus. Do you perhaps know other kids that have this? And I mean, it sounds like it's pretty straightforward KTS, but she's
Yeah.
also saying fava, so maybe there's some pain associated with it. And she's in Greece, so maybe when you're there, you can see him.
Sure, and in association with Stavros, but I think you summed it up pretty well, Linda. The patient probably has a straightforward KTS, and that's what was the question though?
If the beta blockers and sirolimus,
Yeah,
how do you
That's
think about
absolutely,
that?
yeah. So I would not use beta blocker in this instance. Sirolimus or sirolimus is fine. And in fact, it has been used quite extensively in these patients and has improved symptoms. So it is associated with an improvement in symptoms, especially pain, etc. So sirolimus is fine. A beta blocker is not. I don't think it has any role here.
Okay. And also, do you know when you will be in Greece again? So she could contact us.
In sometime in January.
Okay, so just
Later in January, sort of first or second week in January. I have to look at my diary, but Dr. Tombris, Tombris, Dr. Tombris in Athens, his office will know.
yeah, and she can contact the EVA clinic. It's EVA clinic for European vascular anomalies.
Correct.
So Mathar writes that her 4-year-old son has lymphatic cysts on him and that they are turning blue. Should she be concerned?
Yeah, so once again, they're turning blue because these are some of the changes that take place in lymphatic malformation in lymph cysts. Turning blue generally means that there's some blood or blood product in the cysts, and this is something that happens from time to time. Is it something to be concerned about? No, it's something that normally happens. Doesn't mean anything bad.
Okay. So Joe Roth writes and says, I have a port wine stain on my eyelid, and a lot of the time I feel that there is something bothering me in my eye. It's more heavy and sometimes it hurts. Is that because of my port wine? Can laser help with the pain?
Okay, so it very likely is related to the port wine stain. I can't say for certain that it is, but it's most likely to be. And laser alone will not help. If the eyelid is very heavy and thickened and symptomatic, you probably need surgery as well. So you probably need to be treated with port wines, with laser and with surgery.
Okay, thank you for that. So Ashley writes, no, you didn't miss it, this discussion about this, but her son has a port wine stain over his eye, scalp, and forehead, corner of his forehead. Now she says his head circumference has always been high. Between appointments, jumped off current growth trend. He has what I think looks like frontal bossing. I was told it could be something like overgrowth phenotype. He is 4 months old.
So there is a syndrome that, we need to tell you that there is a syndrome associated with the port wine stain and a big head. And it's MCM, right? Macrocephaly and a capillary malformation associated with it. And so, once again, I think you should go to somebody who knows a lot about vascular malformations and be evaluated for MCM.
Yeah, it's MC macrocephaly CM. And Dr. Comey speaks about this too with patients with Sturge-Weber. So this child would have to be worked up for Sturge-Weber as
Yeah,
well.
and that's another possibility, but I don't think it's just frontal bossing. I mean, she mentioned that
Right.
the skull circumference is off the charts, and that's not just frontal bossing, that's macrocephaly capillary malformation.
Yes, true. Okay, Inga writes, our daughter turns 20 today and has a vascular malformation deep in her left leg. It's about the size of a half of a liter bottle. She has had one surgery in November of 2019 and one in January 2020. After the second surgery, she got 3 blood clots, so they stopped the treatment. Before Corona, we were looking up if it was possible to see you in Berlin, but now everything has stopped in Denmark. So they're in Denmark, but maybe they can see you in Greece in January.
Well, they can come to Berlin. I mean, we have patients, you know, yesterday and the day before from everywhere. So there's no difficulty in travel as far as I know.
Well, she's from Denmark and she's saying everything's like on lockdown there.
Okay, all right. So
but
that's
maybe you could
yeah.
see them in January in Greece.
Yeah, in January in Greece, and I'll be back again in Berlin in March. So, you know, there is no possibility. As far as this child is concerned, so just go through the question again, Linda.
Her daughter's 20 and has a vascular malformation in her left leg. So she says that she's had two surgeries,
right?
Right.
Yeah.
And she had 3 blood clots following the surgery.
Yeah. So, you know, this is something that I need to see. I mean, there are several possibilities. Why were there blood clots? Is this part of the vascular malformation? And it could be part of KTS, or it could be something else. But it's most likely associated with a malformation, and it's most likely KTS. And so in that instance, you do get blood clots, but I'm wondering why. There's more information that we need to fully answer the question.
Yeah, I think it's
so
again,
I don't think I can.
Yeah, we posted your email, but again, she's probably going to just have to come and see you either in Berlin or Greece with any imaging, and then you can, you know, make a better decision.
Yeah, there's more information that I need. So if she emails me, I'll be able to sit down and read it through very carefully and answer.
Correct. Okay, so Jody writes that her son is about to turn 6 and he has a large port wine stain over his face, his ear, his scalp, down to his chest, but she hasn't been told if it affects the lip or inside of his mouth, but she thinks it does. She's been getting him laser treatment since he was 3 months old, and as I said, he's 6. They've ruled out, you know, any glaucoma, but her question is, other than seeing a dermatologist and an ophthalmologist, should we be seeing any kind of a doctor for any other reasons? Because this is like a head and neck port wine stain.
Okay, so if they've seen an ophthalmologist, it is the type of port wine stain that they probably ought to have an MRI at some stage. So I would say that an MRI at some stage should be undertaken to rule out Sturge-Weber syndrome. But really, it doesn't concern me if there is staining on the inside of the cheek, because it never really progresses and it never really causes a problem. So apart from laser treatment and apart from seeing an ophthalmologist, I would get an MRI.
Okay, thank you for that. A quick shout out. Hello to Corinne from Seattle and Nick Antonelli from Florida. So hi to both of you. It's always great to see you on. Nancy writes, my 26-year-old son has a vascular malformation which wraps around his kneecap. he has severe, and it got cut off, but it looks like she was gonna say he has some severe, maybe scoliosis or something with it. But I guess I need more information from her. She didn't, oh, wait a minute, here it is. So it wraps around the knee. He's had several sclerotherapies, ablations, some with success, most not. It has enlarged in the last year. He's in great pain and concerned about more procedures making it worse. What are your thoughts? This
Okay,
is, again,
so
it's on the leg and it wraps around his kneecap.
yeah, so we'd have to look at it and see whether surgery is feasible. Having more sclerotherapies is not going to accomplish anything, especially if they've been unsuccessful. So my answer is we need to take a different look at it and consider something else. He has ongoing pain. He does need to have something done. And so surgery is the other option. Or alternatively, sirolimus. Sirolimus has been shown to help patients with pain, especially vascular lesions of the leg or of the limb. And so some other modality should be considered.
Okay, thank you. This is a great email. Her name is Carmen Eder, and she's writing from Berlin. And she wants to thank you for everything you do. And she has a port wine stain that's been lasered in Vienna years ago. But now that she's in Berlin, she wants to know where she can go to get her port wine stain lasered.
Okay, so just put her in touch with me and I'll tell her exactly where. We have a clinic here and she's welcome to come, yeah.
Yep, so Dr. Waner's email is in the thread. He is, I don't know how long you are. How long are you in Berlin?
Tomorrow is my last day, so we have surgery all day tomorrow. And then I leave again on Thursday. But I can certainly point you to the clinic and the clinic can take care of things. And
yeah, because you'll be back. You said you'll be back in March, right?
Correct,
and you do laser there when you're there, correct?
Yes, that's right, I do.
Okay, thank you. So some of your followers from Israel are saying hello. And and when will you be back in Israel?
Yeah, so I'm very disappointed because I was supposed to go directly from here to Jerusalem. And with the lockdown situation in Israel, I had to cancel the trip. And so everything got canceled. I'm hoping to go in January. We've got to obviously watch the situation. From my perspective, I think there's much to do about nothing. I don't think the Omicron virus or the Omicron type mutation is much to be concerned about. All indications are that it's a fairly mild viral mutation, or it causes a mild clinical illness. And so I think we'll be back in business fairly soon. So I'm hoping to be back in Israel mid-January, probably.
From your lips to God's ears, right?
Yeah. You're right.
So Jeremy says, are there any new treatments for venous malformations? I have one in the oral pharynx extending into the nasal pharynx. I've had a session with sclerotherapy, which didn't have any impact on the growth. So I think this would be one that he should directly be in contact with you for treating, correct? Oh, you froze, Dr. Waner. You gotta unfreeze yourself. I don't know what happened, but he's frozen. Oh, we can't hear you, Dr. Waner. It's all garbled. Not sure what to do because he's sorry. Wait, are you there, Dr. Waner? Oh, let's see. He's not here. not sure what to do. Should I go back into the Zoom?
You're in Zoom right now.
Okay, so how
Wait
do,
for him to come back in.
okay, I guess, sorry, everybody. Will, hopefully he will be back in with us in 1 second. Otherwise, I don't know what to do because he is live. You know, we were live from Berlin and sometimes this happens. Not seeing him coming back in. Are you seeing it?
No,
No.
you'll have to get permission for him when he enters the room again.
Yeah, I was, it's on the live though, right on the live. I don't close that and open up the other one, correct? So, because I didn't know if I should go into the Zoom, no, I'm in the Zoom session. Okay, well, we are just, let's see. I don't know if that's Emily. Okay, thank you, Emily.
Just checking to make sure.
Yep. So, thank you. So we're just waiting for Dr. Waner to come back in. I don't know if he will. Yeah, sorry. This has been, well, we got 40 minutes in, and that may be what we end up with for today. I'm really sorry, everybody. I know we've had so many questions here for Dr. Waner. And if we're not able to loop him back in, what you will all have to do, you'll all be able to email him directly. I see Renee, I see so many people writing in. I'm really sorry. This is one of the things when somebody's in another country and we're merging us. So we're really, I'm still waiting to see if he does try to get back in. I'm hoping he went back to the Zoom link and that he's trying to get back in the room, but I don't see it. So I might have to call this and I'll give him 1 more minute. Again, sorry, let me see if there's any I can ask. So let me, until I get him back on. The doctors in Denmark have no kind of treatment, but they're talking about sirolimus. Dr. Waner does use sirolimus for malformations, especially lymphatic. Shani, 42 with a large lymphatic on your thigh, you had sclerotherapy. We don't know any in Canada. We do have our free conference every year that will be in California in October. And if you come to that, it's a good way to, it's free. So it's a good way for you to try to sort it out because one of our doctors is, Dr. Nelson is from there. Okay, restarting treatments, large venous in his buttock and leg going down. He has lots of small clots. Again, Charlotte, you can write to Dr. Waner and he will respond to you. You can also write to Dr. Delphinian or Dr. Rosen, our extremity experts. Hi, Sergey. Hello, Renee. I'm sorry. I'm still giving it a minute for Dr. Waner to come back in. I know that you're having problems and I'm hoping you got in touch with Dr. O and that she can help you. Let's see. Oh, there he is. He's coming back. So let's see. I'm not seeing him yet. Okay. It says I admitted him, but I don't see him, Emily. So it did say, oh, are you there, Dr. Waner? Okay, there you are. Do you have your sound on? Oh yeah, he's connecting with his audio now. So this is great. I'll go back to these. Are you there, Dr. Waner? Well, he's just connecting. And I will start with this. Okay, can you hear me, Dr. Waner? I don't hear you. I see you. So I know you tried to come back in. Thank you for that effort. I was trying to answer some of these questions for you. Since we have 15 minutes left, I don't know what to say, but I think Dr. Waner can hear me. So he's just not able to connect to his audio. And he's frozen once again. So again, we have his number for you, and I've seen the questions from Canada. restarting treatment. Oh yeah, you were saying, oh yeah, he's gone. He's out again. I guess we'll give him one more second to come back in since we have 15 minutes left. Here he comes. Stay tuned. He's trying to come back in. Let's see if we can successfully make this. There you go. So we need your audio.
Yeah, sorry.
Thankful. Thank you. Thank you, Jesus.
Can you hear me?
Yes, thank you. So let's get these. I was trying to answer some. One woman wants to know, she's from Canada, if you know anyone up there that can treat a large lymphatic malformation of a left thigh.
Which part of Canada?
She just says she's from Canada.
Yeah, I know that there is a group in Vancouver, but you know, Linda, I don't know off the top of my head anybody, but maybe they should send me an email.
Yeah,
There is a group. Yeah.
I told everybody I was trying to answer some questions because I didn't know if you'd get back on, but I just told her to write to you and to also come to our conference in October in California because Dr. Nelson knows quite a few in Canada. But let's get through these ones. So Charlotte says her son has a large venous malformation on his right buttock and down his leg. He has lots of small clots and they're causing him pain. What do you recommend?
So he's got a venous malformation down his leg.
Buttock
He's got
and leg and pain. Yep.
Pain. And how old is he?
She doesn't say. But
Yeah,
he has small clots and they're causing him pain.
okay, so, you know, blood clots do cause pain, unfortunately. We probably need to prevent them. There probably is medication which can be used, probably sirolimus. I think this person needs to be seen by either somebody like Rosen or myself, you know, somebody who deals with this, because there's more information that I need to be able to answer this.
I agree. And they can email you and schedule something, or they can, you know, since you and Dr. Rosen are so close, they could see you and then see Dr. Rosen.
Yeah, very much.
Day. One of your longtime favorite patients, Renee Garrett, you know Renee from Arizona.
Sure.
So
hi, Renee.
she had a hysterectomy and they found like a lot of clotting and a lot of stuff that made me suspicious of, you know, a syndrome, or it sounded to me very much like vascular anomalies. And now she's having problems since the hysterectomy that she had in September. She's having a lot of problems with her malformation. I did have her email Dr. O, but she's having some problems and she's trying to get to New York, but she wants to know if there's anything she could be starting, any medication or anything now to slow this new activity down before she gets to see you in New York.
Yeah, you know, the problem is she's had a hysterectomy, and then this comes with a dramatic change in hormonal balance. And the hormonal imbalance could be what triggered this off. So, you know, that's a possibility. You know, I don't really know what to say other than let her email me directly.
Yes.
And see what we can do. But definitely the hysterectomy may have set off some hormonal imbalance. And if that's the case, then hormonal treatment may help. And so speaking to your gynecologist about hormonal treatment may be helpful.
Well, I was thinking of that too, actually, even though she's had the hysterectomy and what we know now, I actually mentioned to her to mention to you and Dr. O, she may be perfect for the progesterone only and the doxy combo. No, I think Dr. Waner froze again. Oh, there you are. We're almost done, Dr. Waner, but I did lose you again. I can't hear you.
Can you hear now?
Now I can hear you.
Yeah. So the signal's coming in and out. I don't know what's going on.
Well, we only have a few minutes left. We'll be fine. So I'll just have, I already said that I talked to Renee to talk to Dr. O about the doxy and progesterone only, combo. That may be perfect for her.
Yeah. Yeah, I
Um,
think so. Yeah.
So, yeah, Rebecca just wants to know her baby has a growing hemangioma on the top of the head, and the doctors are telling her to just wait and see. She wants to know what the guideline is, like, should she intervene? Should she get treatment? What should she do?
She should get another opinion for sure. We don't wait and see for most hemangiomas. I mean, it may be a small one, in which case, yes, you can, but it doesn't sound like it. So the answer is get another opinion.
Right, thank you. Magna, I will be in Italy in March with Dr. Coletti for our free laser clinic. And then Ashley said, my 4-month-old son has a port wine on his skin, on his eyelid and temple and scalp. He has a large head since birth. His front forehead looks frontal bossing, so I guess this is another one like that. Someone mentioned this. Should I be looking for some kind of phenotype? I'm not sure if this relates to this question or not. Like, should she be looking for, because she's another one that says her son has the port wine, and then she's got some head enlargement, and should she be getting some genetic testing done?
Well, I wouldn't go with genetic testing just yet. I would definitely see somebody who knows what's going on. It sounds like it's related, and it sounds like another possible MCM or something. So the answer is see somebody else, see somebody who knows, or write to me and I can help point you in the right direction.
Okay, so we're almost done, but Ra wants to know, do you treat adults with hemangiomas?
Yes, and adults don't have hemangiomas. They have vascular malformations, and the answer is yes.
And then Ram says, until you can get to Israel, because I guess he was waiting to see you, he's 38 with a microcystic tongue, and he wants to know, can I do anything until you can come because of the swelling? Like, what about the steroids and antibiotic? Remember you used to do that combo?
Yes, so steroids, but you can't take steroids indefinitely. But the answer is yes, courses of steroids would help. I am hoping to be in Israel in January, so it's not a hell of a long time, but a course of steroids may help.
Okay, thank you. So Yanni says her daughter was operated on for a giant cavernous nasal hemangioma, and that she will need other interventions, complete nasal reconstruction. She had an artery feeding it. Can you help us? We are from Panama. So I think they need to send the case to you, because it sounds like it's probably not a hemangioma, or it may be one with high flow, but it sounds more like maybe an AVM.
Yeah, probably.
So that they can write to you.
Correct, yeah.
So we've got like just 1 or 2 more minutes left. My adult daughter had one treatment for her port wine stain. It looks good, but she has blebs, but they're flat. So can a laser help with those? They must be just coming out.
Yes, and the answer is yes. Laser can help with that.
And she's getting married in June. So she said, should she be doing that now? I say yes.
Yeah, yeah.
And then Jasmine's 3-year-old daughter has a CMAVM, and she has thickening on her brow and eyelid and fistula behind her eye. We're told laser is out of the question. What treatments should we be looking for?
CMAVM with a fistula. you know, once again, this is complicated. What treatments should we be looking for? For the stain, well, laser is not helpful with a stain of a CM-AVM. You can try it, but generally it isn't helpful. So it depends on what they're looking for. You know, tissue expanders possibly, and removing the skin is a possibility. The fistula should be treated properly. You know, this is a very complex question. Perhaps
Right.
they should write. Yeah.
Agreed. And then a quick one was just someone wants to know if you know of anyone down in North or South Carolina. I guess we could recommend Dr. Hockman to them. And unfortunately, we are at the bewitching hour. And any more questions, you can definitely contact Dr. Waner. We posted his address. For those of you wondering about Italy with the free laser clinic, you can go to our website. There's a registration form. So whether you just want to be seen in a clinic or the free laser, go to birthmark.org/conferences, or you can email me. And I want to thank you all. I don't know if Dr. Waner will be able to get back in or whether he's just done, but at least we got through it. And I want to wish you all let me just do a shameful little promotion here. Wish you all a happy, safe, happy holiday season. And we do have a promotion going on where you can get one of these amazing pins. They're sterling silver. And you can see it has like the hand over the face, which is was designed, this little sterling silver pin was designed for VBF. And for any donation, end of year giving, you will get either the pendant or the pin. You can request it. All of our Facebook Lives are on our website. Just click on the YouTube channel link and you can view all of them from back to 2017. You can go back and reread and re-listen to what Dr. Waner had to say today or on any of the previous ones. And you know, this is what we do. This is what VBF does for you. We do these monthly live sessions. Next month, I'm not certain, but I believe it'll be with Dr. Nelson, live from California. That will be announced because I'm not actually sure. Still a lot of travel issues going on with all of us here. So stay safe, have a happy and healthy holiday season, and I will see you all for the January VBF Facebook Live. Take care. God bless.